Want to bring in Dr. Joe Congeni from Akron Children's Hospital with us here at WAKR. And Joe, I've been telling Gene all morning long, I've been waiting to talk to you today.
Okay.
We got the Jason Kipnis injury. Right?
That's right.
Okay. The ham bone, right?
The hamate.
Hamate
Hook
bone.
of the hamate.
Hook of the ham. Now, my question is, because it's the same thing that took down Jose
Yes, it
Ramirez.
is.
Is this an injury that and I don't know if you know the answer to this, is this an injury that we're going to start to see more and more of with the way baseball has changed on how these guys are turning and really torquing and trying to drive that ball? Because you mentioned to me that a lot of that comes from the constant pressure down there on the bone. Could you see that as being something we'll see a lot more of, or is this just an isolated case?
No research to back this up at all, but 31 years of experience. And my answer is I do not think so.
Okay.
I think I've seen this in baseball players for a long time. We've seen an isolated incidence here in Cleveland of half of our infield getting wiped out from it. But hook of the hamate's been around a long time. I think, with baseball, the nature of the game overall, and I don't see enough of a significant mechanical change to say that it's going to go up significantly. Although that being said, I'm here to say that one of the things I'm a little worried about with quarterbacks is these elbow sprain injuries becoming a bigger deal. Is as quarterbacks get hit with the shoulder and elbow in an extension position, they put stress on that ligament on the inside part of the elbow. And what happens in a situation like Ben Roethlisberger is that he has this, and it's a repetitive injury over and over again, and they get micro tearing, and then all of a sudden with one particular throw, they'll tear the ligament completely.
Is this like a Tommy John thing?
It's like a Tommy
play?
John thing, but there are a couple of other surgeries that are done in quarterbacks a little bit different. It's handled than in surgery than it's handled in baseball pitchers. But it even goes back to Bernie Kosar, this great Bernie Kosar injury. It was against the Kansas City Chiefs. There was a blitz on the outside, all this discussion about who didn't pick it up and all that. Bernie says the rest of his career he had trouble with velocity on a lot of his passes, and that elbow was never right after that injury. So that is an injury that we see a lot too in quarterbacks. Hook of the hamate is injuries that we see a lot in the hand. I don't know, Ray, if we have an hour today to go over. There's so many sport injuries. I wanted to talk about one other one that was in the media a lot because it's such a good teaching point. And I know I might have missed the luster of it being at its full blown, but Sam Darnold's mono case. I wanted to get to that. So why is he out with mono? So many of our high school kids and early college kids get mononucleosis, okay? It's a viral infection, Epstein-Barr virus, like the flu virus, like, so many of these other viruses that give you upper respiratory symptoms. In fact, a week ago today, they were saying he had a bad case of strep throat. Do you remember that report coming out?
Yeah.
And then they tested him further, saw that it was mono, and the big problem with mono in any contact sport, not just football, but soccer and basketball, is that the spleen doubles in size, triples in size. The spleen, the organ on the left-hand side of the abdomen, the belly, doubles and triples in size because it's filtering out some of these abnormal cells that are in the bloodstream. And for 2 to 4 weeks, with that spleen being enlarged, there's a very high risk of any hit that you would take to that left side of the abdomen to tearing the spleen, rupturing the spleen, breaking the spleen, bleeding significantly from the spleen. And every year we have cases in our emergency room here. So in high school kids and college kids, this is a take-home point for parents and coaches and athletes, that when you get those bad upper respiratory infections, some of the times getting in to see your doctor to see, could it be mono? The reason it's a little unusual in the pros is by 22, 25, 30, so many people have had mono already, they don't get it at that age as much. But Sam Darnold brought it into the spotlight, and I wanted to bring it out. If you're a kid in a contact sport and you get those kind of big, swollen gland, runny nose, a really bad, you think it's just a viral infection, a lot of times getting those checked for mono, a blood test for mono, is really helpful to your medical team.
You touched on some of them, warning signs of mononucleosis. Being tired, isn't that one of them as well?
Being tired, yes. Fatigue.
Fatigue.
Significant fatigue. But again, it's a spectrum illness from pretty somewhat mild to very significant, knocking people off their feet, big swollen glands. They talk funny because they have so much swelling and sore throat. They're out of school. So those are easier to pick up. Some of the ones that are more mild are a little harder to pick up. But for the sport medicine team, it's really good to know that, because we don't know who's out there just playing on a Friday night, who's playing soccer on a Saturday, who might have an enlarged spleen. They're playing with a cold, what they think is a virus. They get hit in the stomach and oh my gosh, hey, keep an eye on them if you're the medical team. 15 minutes later, a half hour later, they're still short of breath. They have pain in the stomach. They have pain in the left shoulder. It refers the pain to the left shoulder. We check their heart rate and blood pressure on the sidelines. We teach this to all of our athletic trainers. That heart rate continues to stay up. The blood pressure starts to come down. You got to get that kid to the emergency room. They could have a bleeding around the spleen in the abdomen.
All right. Good education this morning. Thank you, Joe.
Okay. I'm glad we got to touch on a few of those others too, right? Yeah,
that was
thanks.
good stuff. All right.
All right.
Dr. Joe Congeni, Akron Children's Hospital Sports Medicine Center with us on the Ray Horner Morning Show, 1590 WAKR News Talk Sports, and now